See that? Inside of this jar, an organism no larger than the tip of a ballpoint pen. This tick can literally lead to a world of chronic pain, deep-rooted frustration, and feelings of abandonment. It has also ignited a contentious national debate over Lyme disease. Over the next half hour, we will peel back the layers of this controversial illness. You will hear from a doctor who lost his heart, a child who has lost the ability to walk, and a singer on the brink of stardom who nearly lost her ability to perform. But first, Lyme. What is it, and how do you get it? Here's Liz Dahlem.
Lyme disease is an infectious disease carried by a black-legged tick, more commonly known as a deer tick.
And when that tick bites you, as it's bitten, it starts to inject some of its abdominal contents into the skin, and thereby it brings whatever is in its stomach into the human. And so that might contain microbes that cause Lyme disease.
Dr. Brian Fallon is the director of Lyme and Tick-Borne Diseases Research Center at Columbia University. He says in most cases, patients develop a rash and flu-like symptoms.
Fatigue and muscle pains and joint pains. You might feel like you're totally exhausted, and you feel like you need to be in bed, and your brain is not thinking clearly enough.
Fallon says if a tick is found on your body, save it and take it to the doctor for testing. A specialist can determine a course of treatment right away. If Lyme disease goes untreated for 2 weeks, there can be serious side effects.
Mood symptoms, sometimes prominent anxiety attacks, and rarely it might cause some very serious psychiatric symptoms such as paranoia, sometimes a bipolar-like disorder.
But with Lyme disease comes controversy. Questions over testing and treatment have triggered a national debate among health professionals. And caught in the middle, the patients.
Most people don't recall a tick bite. Most people don't recall a rash, unfortunately. I wish they did, because if they did, they can get treated earlier, and early treatment is associated with better prognosis. But for even in those early stages, the relapse rates are in excess of 20%.
So what's the first inclination that something's wrong?
They have flu-like symptoms, they think it's the flu, then the next day it gets better. So typically Lyme comes and goes on its own. So they say, oh, I'm over it, and then 2 weeks later they're sick again. The unfortunate thing is people will turn around 6 months later, and it's kind of this pattern, and their functional status is such declined, they go, what happened to my life?
But answering that riddle has triggered endless debate and controversy over how best to treat the illness.
The doctors kind of fight on how long and how aggressively Lyme disease should be treated. So there are two medical societies that have very polarizing views on Lyme. One's called IDSA, which stands for Infectious Disease Society of America, and they advocate for a shorter-term treatment. The other's called ILADS, which stands for International Lyme Associated Disease Society, and they advocate for a kind of case-by-case treatment. For the people who don't develop chronic symptoms, they advocate for a shorter treatment is okay, and for people with longer-term and recurrent symptoms, they advocate for longer-term antibiotic therapy.
But this type of treatment presents concerns for the Centers for Disease Control and Prevention.
The ILAD guidelines advance two basic ideas. There really is not any adequate scientific information about the management of Lyme disease. In the absence of that, healthcare providers should be free to do and treat patients in whatever way they see fit. Our concerns are that that misrepresents or does not give full credit to the amount of scientific evidence that there is about management of Lyme disease. And perhaps more importantly, we are concerned about patients who are being treated with unproven therapies.
The other issue, testing for Lyme disease.
The tests that are used to diagnose Lyme are 40-year-old tests, which have very poor accuracy. So we have bad tests to diagnose it, and once it is diagnosed, we don't have a test to show that it's gone.
Early in the course of infection, the test may be falsely negative. And so there is a window period early in the course of infection, by which I mean in the first few weeks, when a patient may be infected and not yet test positive.
Unfortunately, that song all too familiar to Dana Parrish.
I was at the prime of my life. I'm a songwriter, I'm a singer. I just signed a deal with Sony, a 3-year deal, and right before I signed the deal, I was bitten and my whole body went haywire.
We fall down.
I had sort of every manifestation of Lyme. I had heart, my joints hurt, my limbs, my fingers and my toes were tingling. I had anxiety and depression and insomnia. So I was in pretty bad shape, and I had gone to 11 or 12 doctors in New York City. I kept going to infectious disease doctors. I kept asking if it could be Lyme. They kept saying no.
They said unequivocally, you do not have this.
Unequivocally, you don't have it.
Like so many in her shoes, after going through a checklist of symptoms, Dana realized all signs pointed towards Lyme.
I was on vacation in California, found a doctor that was a Lyme specialist, agreed to see me on vacation, was very kind, knew immediately that I had Lyme, and then I came back and started treatment with Dr. Phillips.
How did that doctor know immediately, though? I mean, if 11 other doctors didn't know that you had this, then how does this one know immediately?
Because he's a specialist, and because that's what people need to know, is that they should not be going down this rabbit hole.
Both patient and doctor have now come together in a unique effort to raise awareness about this debilitating disease.
When the science backs it up, you have to do what's right in this world. At some point, that's all it comes down to. And I encourage the patients, like I said, if something doesn't feel right, to look further. Do not take things at face value, because it's frequently not correct.
I think that people should take their symptoms a little bit more seriously and not blow them off, because time is of the essence when you have Lyme in a lot of cases, and the longer it goes on, the more difficult and the more painful the treatment is for a lot of people.
Next, the doctor diagnosed the Lyme battle that cost one physician his heart. Stay tuned. The controversy of Lyme begins at first bite, a small mark that can lead to a very big bill. So who pays for it? Allison Morris investigates.
Insurance companies generally refuse to cover any kind of treatment beyond 28 days.
A startling reality for many people battling chronic or persistent Lyme disease. Because the CDC guidelines characterize Lyme as hard to catch and easy to cure, antibiotics may only be covered for a matter of weeks. Paying out of pocket can be financially devastating.
I know of families that have been completely financially ruined trying to treat themselves or their children.
Susan Green would know. She's the legislative counsel for the nonprofit, the National Capital Lyme Disease Association, and a Lyme disease advocate who was misdiagnosed herself.
I had a seizure in the middle of a trial. I lost my ability to speak, lost use of my limbs, and I found out later that I had passed Lyme disease to my son in utero.
Dr. Paul Mead with the CDC says they want people to be properly diagnosed and treated, but studies show antibiotics may not be the solution, and that may influence the insurance companies.
Patients who get antibiotics improve, but they do not seem to improve substantially faster or better than patients who got placebo. So that may influence some of why they are choosing to cover or not cover those costs.
The effects of Lyme can be lifelong and spiral into unforeseen medical complications. For world-renowned oncologist Dr. Neil Spector, Lyme robbed him of his heart. I sat down with the doctor turned patient to hear his story.
The doctor-patient relationship is all important, especially for Lyme disease, a disease where people often feel very isolated from the healthcare community, who may not believe that they're sick, often sadly isolated from their own families, who believe it's all in their head and they're faking it. And I understand from a personal level, so it gives me
Deeply
sort of that,
personal.
that sort of street credibility.
It was 1993. A then 37-year-old doctor, the picture of health with a bright future ahead, became the one in need of care.
I figured I was immune to getting sick, right? I mean, I took care of people, not the other way around. So I got bit by a tick and never saw the tick, just like a lot of people with Lyme disease don't remember. The ticks are almost like a speck of dust. So I went from running marathons to literally within a span of months to barely being able to walk 20 yards without having to stop for extreme fatigue. So I knew something was wrong. I was having arrhythmias, so my heart would start racing upwards of 100, 200, 180 beats a minute. And every time I'd go to the emergency room, the arrhythmia would have resolved. And they would say, you're a physician, you're
So you
writing
told them
grants.
you were a physician.
They knew I was a
Were you
physician.
going to your hospital where you were practicing or affiliated with?
I was going to the medical school that I was working at, and I had very compassionate physicians. And my blood counts were normal, the tracing of my heart rhythm would be normal, and they'd say, "You're stressed."
And An eventual diagnosis of third-degree heart block and a potentially fatal arrhythmia led to the installation of a permanent pacemaker defibrillator.
So I essentially had a 911 unit in my chest that would shock me if I had a potentially fatal arrhythmia.
Ongoing heart issues and other symptoms compelled Dr. Spector to solve the riddle himself, a puzzle in which all of the pieces pointed towards Lyme.
I forced my doctors to repeat the test. They diagnosed Lyme disease. Finally, I was treated aggressively with antibiotics. Most of my symptoms resolved, but the damage to my heart was permanent. And then in June, actually, of 2009, I went into florid heart failure and was told by a surgeon that I had 72 hours to live on a Friday afternoon, July 17th, that I would be dead by Monday without a heart transplant.
Dr. Spector chronicles his experience in his new book, Gone in a Heartbeat, A Physician's Search for True Healing. 7 years after undergoing a successful heart transplant, he now leads an active life once again, but he is determined to make a difference in the Lyme community.
I'm not somebody who's out there, you know, on the lunatic fringe that
You're not a quack.
I'm not a quack. You know, I've been in academics all my life. I've developed 2 cancer drugs. I've published in the best journals. And so if this is happening to me, you know, I feel obligated. I need to be out there saying, we need more research, we need more awareness.
Coming up, you know her as the daughter of a fashion icon, Allie Hilfiger, bit by a tick. Now Allie bites back. They're rich, they're beautiful, and they appear to be the picture of health. But that's not always the case. Arthur Chien shows us why even some celebrities aren't immune to Lyme.
It may be called the quiet disease, but when Lyme disease hits, its symptoms are anything but. Its victims arbitrary, like singer Talia, who in 2007 was pregnant when this happened.
I lost my hair, I was like a bone. I couldn't move, I couldn't talk, I couldn't think, I couldn't leave my bed for months.
I was having stomach problems, I was nauseous, I was very tired, my joints were very achy.
Marla Maples, along with Talia, are just some of the high-profile faces using their celebrity status to fight the disease, claiming 300,000 new cases each year now. For Maples, her symptoms linger nearly 3 decades after she was diagnosed.
There's still some symptoms I have now, like brain fog, that I wonder, and sometimes my joints are a little achy, so I'm going to retest.
With such a high permanent cost of Lyme disease, the emphasis is really about the rest of us getting better about detection. And celebrities are hoping that by publicizing their personal battles, more people will be paying attention.
I hope that we can raise enough money and you know, get people educated and hopefully find a cure soon.
Another celebrity fighting back? Allie Hilfiger, the daughter of a fashion icon. She shares with Linda Schmidt how one little bug bite nearly saw her committed.
I look back and I think, how did I get through that? People die from this. Yeah. I could have died.
And Allie Hilfiger still isn't cured. Lyme disease continues to inhabit her body. The life that she's led is not what you would expect from the daughter of Tommy Hilfiger, one of the most successful fashion moguls in the world. With all of their resources, Allie's parents didn't know why she was so sick.
Even if you have privilege as I did, we still couldn't find an answer for 11 years.
Allie details her painful struggle in her new book, Bite Me. When she was 7 years old, Allie was bitten by a tick. She says her mother sent it to the town hall where they lived in Connecticut to have it tested. The test results were inconclusive. She says her mom then went to a specialist who said that he couldn't help. Within a short time, Allie started showing symptoms.
When I came home saying, my legs hurt, Mommy, my legs hurt, when the teachers would call and say, Allie seems really tired, and she keeps stretching her legs. Or, you know, she's out of school a few more times than other kids this year from strep throat. She's having a lot of headaches. Even the pediatrician said, you know what, it's just growing pains.
Allie says this continued through her teenage years, her symptoms getting worse. She was in constant pain, her memory was failing, and she became incapable of reading. And Allie was misdiagnosed over and over again.
It might be multiple sclerosis. It's probably fibromyalgia. Maybe it could be rheumatoid arthritis.
As a teenager, Allie had a mental breakdown. Her father forced her into a psychiatric hospital in Connecticut.
Lyme disease invaded my brain. I literally went crazy, had a nervous breakdown, and I wasn't able to understand how to feed myself, take a shower, make a phone call.
Winding up in that psychiatric hospital, Allie says, ended up saving her life. It was her psychiatrist who finally diagnosed her with Lyme disease.
It took over 11 years for somebody to connect the dots.
After that diagnosis at age 19, Allie went through years of numerous painful treatments. Now at 31, she says her Lyme disease is manageable. She is also a national spokesperson for Lyme disease awareness.
If I could find the silver lining in my experience, it is to use my experience to benefit others.
Coming up, blessed by the Pope, saved by the kindness of strangers. The little girl putting a spotlight on Lyme. Stay tuned. When it comes to kids and pets, the issue of Lyme disease cannot be stressed enough. Prevention is key. Stacey Delicat shows us how best to keep them safe.
For a child who shows up in the summertime with flu-like symptoms without cough or cold, especially fever, headache, joint pain, I have to think about Lyme disease.
Infectious disease pediatric specialist Dr. Patricia Delamora has already seen plenty of cases of Lyme so far this summer. If your child plays outside in or near a wooded area, she says dress them in light-colored clothing to easily spot ticks and use repellent with DEET. And she says always do a thorough check when the kids come back inside.
In the hair is the place that I see children get missed every single year because they have thick hair, and the tick is tiny. It's the size of a poppy seed. So really checking the hair behind the ears, in the ear, in the belly button, in the groin, the area covered by underwear.
For Fido, frequent tick checks are also a must.
Ticks usually migrate to the front area of the dog, often around the ears or inside the ears. And if you're feeling with your fingers, you may find a little bump or something that feels like a scab.
Lawrence Putter, the medical director at Lenox Hill Veterinarian, says many dogs may be good candidates for a Lyme vaccine, but he also recommends using at least one other preventative method.
There's the collar, there's the topical things that you put on the back between the shoulders monthly, and now there's also the pill.
Symptoms in dogs include lameness or limping, lethargy, loss of appetite, and swollen lymph nodes. And like humans, treatment often includes an antibiotic.
Lyme disease affects the mind, body, and soul. But for one little girl in Brooklyn, it has taken a piece of her childhood and her ability to walk.
EMGs, EEGs, MRIs, blood tests. I had a spinal tap. They thought it was meningitis and that it was a terminal ileitis.
At the age of 12, Julia Bruzzese has a medical vocabulary that would impress even the most sophisticated adult.
I started not feeling my legs, like having actual sensory deficit.
She uses words and phrases only understood by someone in the fight of their life.
They came in and, just surrounded my bedside and told my dad, we think it's conversion disorder.
Hers is a life sidelined by Lyme. You are so mature for somebody that is so young. How do you stay so strong?
I had to learn how to be strong for this. My normal life was taken away from me.
Julia's story begins upstate, vacationing with her family. She doesn't remember the tick or even the rash. What is seared in her memory is the journey that ensued. Left without the ability to walk, the last 3 years have been a blur of hospital rooms and doctors' offices, pill bottles and PICC lines, misdiagnoses and misinformation.
I remember just laying there and just saying, why God? I just remember getting so mad. Why me?
Then an answered prayer from Pope Francis on his historic visit to New York City.
He came over to me and it was so magical.
When you were waiting in that long line and the Pope put his hand on you, is that the moment that you realized, I'm gonna get better?
That was the first time that I knew that, everything was gonna be okay. And I knew that he was gonna make everything better.
6 days after Pope Francis blessed Julia on the tarmac at JFK Airport, she received her first positive Lyme diagnosis, the sign she says she needed to be treated properly. What followed were the doctors, donations, and the intravenous antibiotics needed to fight this battle.
I think the Pope brought this amazing journey that I am on, and he gave me a new mission in life and a new goal to look forward to. He made my dreams bigger.
Bigger dreams and the support of a community who understands. But the burden placed on her family has been nothing short of tremendous.
One hospital told me I have 3 other children who are healthy. I should concentrate on that.
Julia's dad speaks candidly about the effect Lyme has had on the Bruzzese family.
I lose sleep over this. You know, I dream of Julia walking again. I see people walking outside and I say, why can't Julia walk, you know? It's taken over our lives.
It's estimated Julia's fight has cost the family $100,000 a year. They nearly lost their home, and Enrico was forced to leave his job. He has now dedicated his life to helping his daughter.
I feel like when I say Lyme disease, I feel like a UFO spotter. I feel like doctors are looking at me like I'm crazy. Yet I have a sick daughter who was the picture-perfect 12-year-old girl.
As for Julia, there's no prognosis just yet. Only hope that things will continue to improve.
Just the simplest thing of walking up the stairs and just riding a bike is what I miss. Just spending, walking around, that's what I dream of.
The issue of Lyme is multifaceted and incredibly controversial. For that reason, we have put the full interviews from this special on our website, fox5ny.com. Thanks for joining us for this in-depth look at the damage a tick can do. I'm Teresa Priolo, and for all of us at Fox 5 News, goodbye.